Welcome to the ICUconnect research study, a study designed to help family members and ICU teams connect better to improve care for their loved one. Now, people who have a loved one in the ICU often have so many things on their mind. Many feel stressed or worried, or like they just have a lot on their plate. And because the ICU itself is so busy and filled with so many different doctors and nurses, it can be really hard to know who the family can turn to as questions and concerns pile up. Families can even end up feeling disconnected from both the ICU team and from what is going on in their loved one's care. And even when there is time to talk with the ICU team, families might not know where to start the conversation, because there just aren't good ways to know exactly what each unique patient and family needs most in the moment when so much is happening. And you see, that's why we're doing this important research study. It's for people just like you. The ICUconnect 2 study compares two different programs that are designed to connect families and ICU teams as closely as possible. The first program is the simplest approach, and it involves emphasizing the best practices of high-quality, person-centered ICU care, all guided by the ICU team's best judgment about how to help you. And the second program adds a simple mobile app that lets families report their specific needs and view the most common questions that people ask of ICU teams. Study participants are randomly assigned, like flipping a coin, to one of the two programs. But everyone gets to meet regularly with the ICU doctor. Now, to measure how well the programs improve care, participants complete just a few short surveys using their phone, all at their convenience, and no other activities are required. We know your time is valuable, and so compensation is provided. Your participation in this study could really help improve the way ICU care is provided to the millions of patients and families affected by critical illness each and every year. And remember, this study is supported not only by the National Institutes of Health, but also by your hospital and by your ICU team, who welcome the opportunity to learn more about you and your loved one. Thanks so much for considering participating in and contributing to the ICUconnect 2 study.